Great, you've already got the leaflet, so you'll know how to help Joe avoid getting a pressure ulcer.
What's this for and why do we need this?
Sorry, do you need me to explain a wee bit more?
Please. What is a pressure ulcer?
Right, well, it's an area of damaged skin. You might have heard it referred to as a bed sore. They usually are caused by sitting or lying in one position for too long without moving, or by rubbing or dragging the skin across a surface. They can occur under equipment like splints, or even something really simple like buttons on clothes. They can appear really quickly.
I'm just wanting to go home. I don't need this.
Well, actually, Joe, although you are going home, you're still at risk of developing pressure damage if you don't follow a few simple steps.
Hold on a minute, Joe. Just let the nurse explain.
Right. Okay then.
First of all, anyone can develop a pressure ulcer, right? Especially if they have trouble moving or if they can't change position without help. So that's like people who are seriously ill, or if they've had recent surgery like yourself and they're reluctant or unable to move, or sometimes if there's damage to the spinal cord and they can't move or feel their lower limbs. You're also at risk if you can't feel pain in part or all of your body, or if you're having trouble with bladder or bowel control, that's like your waterworks, or if you've got poor appetite or diet.
Right. I don't have a clue about this.
Do you want to know where these things develop? Now, if you look in, let me show you in the leaflet.
So how can I stop him getting these?
And what can I do to stop this happening?
Well, first of all, don't worry. There are quite a few simple things that both of you can do to help prevent pressure ulcers. And there's a checklist in this leaflet. It's called the SKINS checklist. That's like SSKINS. There are 6 sections to it, and I'll go through them with both of you, okay? So the first one is S for skin inspection. You need to check Joe's skin at least twice a day for signs of damage, right? And particularly look at skin under any equipment. The signs you're looking for are areas of redness or darkness or any blistering or broken skin. If there is any skin discoloration or broken skin, then you need to make sure that you don't spend any more than 30 minutes sitting or lying on them. And you can ask your health professional team for advice. Now that's people like your GP or your district nurse or your physio, right? Now, you need to remember to keep the skin clean and dry, and don't rub or massage it with anything like talcum powder or body lotions, okay? So that's the first S. Second S is for surface. You can put pillows in between your ankles and your knees when you're lying in bed, and you can get aids or cushions. Again, you can get help from your health professional team about things like that. Now, be careful to use lightweight duvets and blankets in bed, and you should try to avoid things that are made of synthetic materials. Cotton's good because that can reduce sweating or friction. Okay? Now, the next one is K for keep moving. It's important to be as mobile as possible, yeah, and that's just remembering to move, basically. You can do simple things like shift from one buttock to the other when you're sitting, or move from lying on your back to lying on your side when you're in bed. Now, if you have a difficulty changing position on your own, Joe, again, there are aids that can help with that, and your health professional team will be able to advise you on what the best ones are for you. It's very important to keep active. A very small change in your lifestyle can make a big difference. So even something like, getting up to make a cup of tea when the adverts are on the television, that can help because it keeps you moving. It helps to reduce any kind of friction. Okay? Now, where are we at? I is for incontinence. Now, if Joe was to be incontinent, and that's like bladder or bowel problems, with your waterworks, the best thing to do is to get some advice quickly from your health professional team. But you should also be sure to change any pads if they're soiled or wet as soon as possible, and to cleanse the skin thoroughly. Okay? You might also be advised to use a barrier cream. Now, N is for nutrition and hydration. Important, eat a healthy diet. If you struggle with eating, like coping with big regular meals, eat little and often if it's better for you, okay? We can supplement that with fluids and drinks which have got extra calories or proteins in them if your health team think that's the best thing for you. You should be drinking, if you can, up to 8 glasses or cups of fluid a day, because that helps to keep your skin hydrated. And the thing that's really good is that your tea and coffee is included in those 8 cups of glasses a day, okay? The last S, that's for self-care or shared care. We try as much as possible to encourage people to take, responsibility for their own pressure area care, as much as they can anyway. Now that can be as simple as just remembering to keep moving. So you can do things like lifting your feet off the mattress when you're in bed, or just rolling gently from side to side when you're sitting in your chair. Remember though to keep eating and drinking properly, and if you smoke, you really should cut down or stop altogether. Okay, so all of these things are things that can help to reduce the chances of Joe getting pressure damage.
And how would I know if I had one?
Right, well, the first signs are like your skin may change colour, or you might see small areas of broken or blistered skin, right? Now, you might feel a little bit of discomfort or pain, but you might not, because not everybody does.
And what should I do if he gets one?
Right, well, if you think that he's developed one, if Joe's developed one, you can always talk to someone involved in Joe's care. Now again, that's the health professional team, so that's your GP or your district nurse or an occupational therapist, a dietitian, physiotherapist, podiatrist. But the important thing is that if we can deal with it quickly, that's the best. So if you think anything's wrong, if you think there's a problem, talk to someone as soon as possible.
I'm really glad you caught us before we left. We didn't have a clue, did we?
Great. Well, is there anything else that you would like me to go over with you?
Don't think so.
No, I think that's been really helpful.
Just keep hold of the leaflet, make sure you read it.
Thank you.